Good evening, all, and welcome to this evening's consumer evening around breast cancer awareness in a COVID world. So welcome to you all, and I'm very, very happy that you've found the time to be here, because I think we really have a terrific evening of talks and discussions ahead of us. So firstly, I should do an acknowledgement of country. And I would like to acknowledge the traditional owners of Australia and recognise their continuing connection to land, water and culture. I'm currently on the land of the Gadigal people of the Eora Nation and pay my respects to their elders past and present and emerging. I further acknowledge the traditional owners of the country on which you are on and pay respects to their elders past, present and future. And please, if you want to acknowledge your own peoples of your own nation, please put this into the chat function at the bottom of the screen. So I'm Patrick Brennan. I'm a professor of diagnostic imaging at the University of Sydney, and I'm also director of DIRECT, which is the program of research that within the University of Sydney that follows the patient through all parts of the cancer journey, from diagnosis to treatment to outcomes and so on. So it's great pleasure, as I said, to welcome you all. And I really want to, I'm very grateful to the University of Sydney Cancer Research Network for supporting this activity, and also the DIRECT Special Interest Group. And also, for the first time, we're partnering with an official group of consumers, if you like, called Pink Hope, and we're delighted to have them on board. This is the fourth consumer event for DIRECT, our focus here is not about giving you lots of data and scientific sort of information, but more it's the focus is on the experiences of people involved in breast cancer awareness and treatment during the COVID-19 pandemic. We hope we'll cover some of the challenges of the last 18 months, as well as providing perhaps some practical advice during the talks from our invited speakers. We have allowed a good period of time at the end for any discussions and questions, and please, this event will only be as good as the questions that are asked. So please feel free to put your questions into the chat, and we will allocate those to particular speakers. So the arrangement is basically we're going to have a series of short talks, and then we will have an opportunity to for you to ask some questions, get some answers. Then we're going to show some videos of particular consumer journeys since they had been diagnosed with cancer. And so we get a real feel of what it's of the experiences of those people who have had breast cancer. Please read the disclaimer on your screens and note that the information in the talks is designed for the general public and does not constitute medical advice at all. The event is being recorded. Now, I should say we've brought together this evening a really stellar group of speakers. We have Sarah Powell, who is the CEO of Pink Hope and is a breast cancer survivor. And she's going to talk about the importance of family history and genetics on breast cancer. We've got Dr. Zoo Cheung, who's a radiologist, and she's going to talk about breast cancer screening and the impact of COVID-19 at a local breast screening service in New South Wales. We're then very fortunate to have Bianca Kamuya, who is a breast cancer survivor, and she's going to talk about navigating breast cancer treatment during COVID-19. Then we have Dr. Jody Fleming, a clinical and health psychologist and breast cancer survivor, and she's going to talk about a range of factors impacting upon survivorship. And then for the panel discussions, those four speakers are going to be joined by Associate Professor Elizabeth Elder, who's a specialist breast surgeon, and Associate Professor Zakir Hussain, who's a demographer and health sociologist. And as I say, these six specialists will be coming together for the panel discussion. at the end. So with no further ado, I think we'll go straight into our first speaker, Sarah Powell, who's going to talk about the importance of family history and genetics on breast cancer. Now, Ms. Sarah Powell is the Chief Executive Officer of the Pink Hope community. Sarah was diagnosed with breast cancer at 29 years old and subsequently found out she has a BRCA1 mutation. With 2 young children who may have inherited this increased risk of cancer, she has been a passionate advocate and supporter of Pink Hope since its inception. Sarah brings to Pink Hope a background in corporate banking and events management, and being a high-risk individual herself, she knows exactly what's important to the Pink Hope community. So with no further ado, I'll pass you over to Sarah.
Thanks, Patrick, and thanks everyone, and welcome everyone to this evening. So like Patrick said, I was diagnosed with breast cancer when I was 29, and that was actually 15 years ago, which I know is giving away my age. And I don't have a family history of cancer, so I don't have anyone in my family with breast or ovarian cancer. So it was a big shock, and luckily for me, my doctor did take it seriously. She did ask me if I had a family history, and did say you were probably too young to have cancer, but she did send me for an ultrasound, which showed that I had a very aggressive type of breast cancer called triple negative. Now, all the way through my treatment pathway, everyone kept saying, you sure you don't have a family history? And I don't. So I said no, and I never got any genetic testing at the time. Now, they also told me that chemotherapy would affect my fertility. So I went through IVF to preserve my fertility, but they lied, and I got pregnant about a month after I finished treatment. And so when my daughter was about 6 months old, I just started to go, it just doesn't feel right. Breast cancer, very young, and it is very rare to get cancer, in your 20s, not impossible, but definitely very rare. So I did a bit of Googling, and I read about having Jewish ancestry, which I do on my dad's side. They are Eastern European Jewish from Lithuania, which are Ashkenazi Jewish. Now, there's a much higher prevalence of genetic mutations in Ashkenazi Jewish families. So I went to Peter Mac and I said, I gave them all my information. They said, yeah, I think you need to come in for testing. Now, back then, 15 years ago, it took 4 months to get a result, which is, crazy when you think about it. I think they can get a result pretty quickly these days. So I went away and they called me after 2 months and said, you need to come in and, we've got your result. So I think at that point, even when they called me, I knew that it probably wasn't very good. And it turns out I have a BRCA1 mutation. Now, the reason that's really important, I think, in this story is that I don't have a clear family history of cancer, and a lot of people don't. And a lot of people, you might be adopted, or you might not speak to your family. So or you might just not know. Now, we did a survey recently through Pink Hope that showed that almost half of Australians do not know if their cancer runs in their family. So that means they're not having those conversations with their family. And Pink Hope, we're very, very, one of our key messages is you've got to talk to your family, have those conversations with your family about your health history, because it could literally save your life. So back to kind of my story, I went through cancer treatment, found out I had a genetic mutation. And at that point in my life, I found the genetic mutation so much harder to deal with because I suddenly had all these choices and decisions to make. So I Googled and I found Pink Hope. This is many, many years ago. Pink Hope was very much in its infancy then. And I became friends with the founder, Crystal Barter, and we stayed friends over the years. I did a lot of fundraising for Pink Hope. And last year she called me and said, look, I'm ready to step down as the CEO. Would you like to take over? So I feel incredibly fortunate because it's literally my dream job. And that sort of 6-month-old baby that I talk about is now almost 14. And, in a few years, she'll be eligible for genetic testing. And, it's a 50-50 if she's inherited this 40 gene, mutation from me or her dad, or, whether she's got a good one from her dad. But, fingers crossed she does. But if not, I feel lucky that I'm working in a space where I'm doing everything I can to change the future for families like mine that have, genetic mutations. So I feel incredibly fortunate. But just quickly, before I hand over to some of the more interesting speakers, a little bit about Pink Hope. So we are quite unique in terms of, there are a lot of pink charities, I know that, but we really focus on people that have genetic mutations. So the hereditary cancer, familial cancer, whatever, how you've heard about it. So, back when Pink Hope started, it was very much the BRCA1 and 2 genes mutations, which cause breast and ovarian cancer. We even know that causes prostate cancer now, but there are many gene mutations now that cause cancer. So, you know, it's definitely, it's growing exponentially, our knowledge of genetic mutations. So we work very much in that space, and we do a lot of support and connection, because when you've got a genetic mutation, you can feel very alone. And so we connect families so that they, you know, have other people that really understand what they're going through. And we do a lot in the education and information space. We have great social media platforms, very engaged, and a great website with lots of information. So I would encourage anyone that's got any, you know, wants to find anything more about having a family history, go to pinkhope.org.au. We've got a brand new website, actually only launched in August. Pretty proud of it at the moment. Thank you. And we also work in the advocacy space. And, you know, it's interesting. We've worked on some really big advocacy campaigns. For example, you might not be aware, but people with genetic mutations couldn't get life insurance. We worked with Monash University to change the legislation in that space. And there's a moratorium of 500,000, still not enough. And, you know, we're working to increase that. But, you know, that's the kind of thing we've done. We've also worked really hard to increase awareness around breast density. Because if you have dense breasts, which a lot of women wouldn't even know, but a standard mammogram won't necessarily pick up a cancer. So, you know, there's different types of screening that you'll need to have. So we try to really raise awareness around that issue. So we sort of work in that space as well. And we do a lot of education campaigns. We don't work in research, you know, that we leave that to the experts, but we do work very closely with a lot of research consortiums and we help sort of recruit for their studies and that kind of thing. So yeah, so that's a little bit about me, a little bit about Pink Hope. In terms of COVID, I would just say this, I think we're all well aware, and if you're not, these are the facts. Screening, doctors' checks, mammograms, you know, any kind of checks generally are down thanks to COVID. A lot of people have put off their appointments, put off their checks. And I would say this, it's time now to prioritize your health. Like, it's so important to get back to your doctor. Any checks or blood tests or screenings or anything that you were thinking of doing and you put off because of COVID, now is the time to book that appointment. We used Breast Cancer Awareness Month to we called it, change it from the to-do list to the you list. And that's such an important message. It's about you. So prioritize your health, because you've only got one body, so you've got to look after it. So yeah, thanks for your time. Thanks for having me tonight, Sydney Uni.
Thank you very much, Sarah. And that was a very powerful story with a very powerful message at the end there about prioritizing one's health. So I'm just quickly going to move on. There'll be plenty of time for questions at the end, but I'm going to quickly move on to our next speaker, who is Dr. Cheung. Dr. Zoo Cheung is a radiologist with a special interest in breast imaging at the Royal Prince Alfred Hospital in New South Wales. She obtained her medical degree from the University of Otago in New Zealand and completed her radiology training at Central Coast Local Health District in New South Wales. She undertook a fellowship in breast imaging with Breast Screen Sydney Local Health District in 2020. Over to you, Dr. Cheung.
Thank you very much, Professor Brennan, for the introduction. And yeah, thank you to University of Sydney for the invitation to this talk. I'm just going to share screen and share the presentation. So at Breast Screen Sydney Local Health District, where I did the breast imaging fellowship, we carried out a little project last year looking at the impact of COVID-19 on our local service, and we had some findings, and yeah, it's an honor to be able to share it with everyone here tonight. So without further ado, I'll start. So as we know, the COVID-19 pandemic has definitely led to changes in our healthcare system locally and globally. And for Australia, we declared this biosecurity emergency in March 2020. And Breast Screen New South Wales last year had a temporary suspension of the screening services between late March to late May. And there's also a temporary suspension of screening this year from the 19th of August. And there's currently a gradual reopening based on LHD or local health district in New South Wales. Other studies elsewhere in the world have shown a reduction in breast imaging studies which were performed during that pandemic. This was looking particularly last year. So for instance, there was a study in the US that showed a reduction of breast screening encounters and also a reduction in breast cancer incidence from in April last year compared to April 2019. And this another local regional study in the US showed that there was a big reduction in screening mammogram numbers that were done in April 2020 compared to their average of April 2018 and 2019. And all breast imaging guided procedures were also reduced last year in the US. So in terms of our local findings, this report by the Australian Institute of Health and Welfare that was released earlier in the year showed that in April 2020, we had just over 1,100 screening mammograms performed across the country. And compared to 2018 across April, there were more than 74,000 done in 2018 April. And when services start to resume, there was a trend of more monthly screening mammograms done between July to September 2020 compared to the same months across in 2018. And they found a similar finding for women in that age group of 60 and above, in that there were more women in this age group coming back to screening compared to 2018 during the months that the service reopened. And for New South Wales, we found there was the lowest number of screening mammograms done in April and May, but from July onwards, there was a very high number of screening mammograms done per month in our state in last year. And so locally at our service at Breast Screen Sydney Local Health District, the service had a total closure of 8 weeks. And since we resumed the service, there were things that had to be put into place in order to ensure safety of staff and clients that came in. So these include, we were limiting the number of bookings, we had to ensure social distancing, and anyone who was unwell would be having their appointments cancelled and rescheduled onto the earliest available. There were also strategies that were put into place here to try and catch up. So these included rescheduling the cancelled appointments during those period of closure, based on the Cancer Institute priority groups, and basically we were sending our client letters and text messages to re-invite clients to come back, and then there were follow-up phone calls that were made for those who didn't respond initially. And in order to open up a bit more capacity, there were Saturday appointments, there were early or later weekday appointments to try and suit clients of different backgrounds. And in December, the service was screening until Christmas Eve. And if possible, at places we would replace our administrative staff by a radiographer if possible. That way we could allow more screens done while not increasing the number of people in the site. So so overall, we wanted to look at the impact of COVID-19 pandemic on participation in screening mammogram and also detection of breast malignancy at Sydney Local District Breast Screen. So we did our proposal to the ethics committee, and that was approved by our hospital committee. And then what we did was we compared the monthly numbers that were found at Sydney Local District Breast Screen in 2020 and compare those with 2018. And these were some of the findings. So in terms of the total number of clients that came to breast screen Sydney Local Health District, we had 16,710 last year, compared to 19,864 in 2018. And if we took out the average of each month, basically, we could see that without April taken into account, because the number would be 0, there's still a little reduction in terms of the average number of people who came to have screening mammograms done. When we did our further analysis, we didn't find a statistical difference with the mean, but the graph basically shows the trend of number of people who were having screening mammogram in the earlier months. Basically shows that there were gradually a return of clients coming back into the service. And in terms of the percentage change of screening mammogram numbers last year versus 2018, we found that there was a trend of gradual improvement in the screening numbers after the service reopened in May. And then essentially in September, there was actually a relative increase in screening mammogram numbers in September 2020 compared to 2018 September. And then looking at December, there were even bigger relative increase in that month compared to 2018 in September. And we also found that the women who were having the second and subsequent screening mammograms returned to the service quicker compared to those who were having their first screening mammogram, which is this dotted line here. But eventually both groups had surpassed the number by December, comparing to 2018 basically. And if we broke down the number of clients that came back, that came to screening mammogram into their age groups, we also found that the breast screen target age groups, which is the 50 to 74-year-olds, they had a faster recovery and return rate to breast screen in our service last year when the service reopened compared to the other age groups. But by December, everybody were coming back into the service. And in terms of screen detected malignancy rates at breast screen Sydney Local Health District, basically each month there will be it will be variable in terms of detection rates, which are we express it as number per 10,000 people basically. But we found that for 2020, from May to September last year, there was a higher rate of breast screen detected malignancy found at Sydney Local Health District compared to the same months of May to September 2018. And overall, the detection rates at Sydney Local Health District breast screen in 2020 remained above the Breast Screen Australia's national accreditation standards. So that was quite reassuring. So in terms of just summarizing what we found, at Sydney Local Health District breast screen, the screening numbers definitely were increasing steadily since the service reopened, and December 2020, we had more clients having screening mammograms in all age groups compared to the same month in 2018, and that women having the second and subsequent screening mammograms, and also women in the breast screen target age groups were returning at an earlier and a faster rate compared to the other age groups and the other screening groups. But we will need future and more studies with a higher sample and a longer term follow-up to adequately investigate the effects of COVID-19. For instance, research on other breast screen services and also on diagnostic imaging centres would be helpful. And finally, the impact, to properly investigate the impact of breast screening's temporary suspension this year, we will also require further research on that. So thank you very much for having me and listening to the presentation. I'll give the screen back to Professor Brennan.
Thank you, Dr. Cheung. I think it's just wonderful when we look at what, for example, your clinic did with the breast screen Sydney Local Health District did to try and adapt to the problems that COVID inflicted upon us back in April last year. I think it's wonderful, you know, working all those hours and right up to Christmas Eve. I think it's just remarkable and a great example of how our health clinicians and practitioners really try to do their best to offer everyone the best possible service despite the dreadful circumstances. So thank you, and to all your team for doing that. Again, we'll save the questions to the end, Dr. Cheung, and we'll I'm sure there'll be a lot of interest in that. I'm going to move straight on to, if I may, to Bianca Kamuya, who's going to talk about treatment impact insights from the consumer. So Miss Bianca Kamuya is a breast cancer consumer. She was diagnosed with breast cancer in 2020 at 36 years old with a grade 3 IDC triple positive. She had a hard time at the moment as she was a mother of a 6-year-old child who was also starting school during the treatment. Bianca underwent initial surgery, mastectomy, in March 2020, which was followed by chemotherapy treatment, and her final exchange surgery has taken place in March 2021. So if I can hand the reins over to Ms. Kamuya.
Thank you, Dr. Brennan. As we've said, I basically was diagnosed with breast cancer in February 2020. So as most of you will know, that's when good old COVID decided to hit. So it was quite an interesting experience for myself. I think probably one of the key messages that I wanted to let everybody know today was that, you know, although I've been through 2 surgery, 12 months of chemotherapy, seeing physios, seeing osteos, naturopaths, and a whole range of other specialists along my journey, I was physically by myself, but I was definitely not alone. And essentially what I mean by that is there are a lot of services and support networks and systems that are out there and available for people who are going through cancer. And there are a lot of people who you can resonate with who actually know what you're going through. So next slide, if we can, thank you. So the Breast Cancer Network of Australia actually put together a really, really lovely video, which I'll just share with you. But essentially, all of the clinicians in all of their specialist fields essentially want to send the same message, which is essentially, you know, although COVID has impacted a lot of the way in which they offer their services, they are there, they are still available, and they are still wanting to assist you to get screening, treatment, and whatever it is you need along your process and your journey. So we'll just hear a little bit from them. Thank you.
And it's particularly more stressful now in the middle of this global pandemic of COVID-19. Whether you're a patient who has cancer now, has had cancer in the past, or whether you're a carer of a loved one with cancer, we understand that this is a very stressful time.
We as radiation therapists will continue to work very closely with you, our patients, to ensure precisely delivered radiation therapy to your cancer on a daily basis.
To help you through this COVID situation, we've designed special radiotherapy regimes for fewer treatments and less hospital visits.
It's completely understandable that you'll be feeling frightened about how things will turn out. As cancer care professionals, we want to reassure you that we have your best interests at the heart of everything we do.
We're hearing from many of you who are having active treatment and worried about your risk of exposure to COVID-19 and what this means for you.
Please know that in these uncertain times, your scans will be completed and reported on time.
There may be some adjustments both to the type of surgery you have or indeed where we do the surgery, but this is really just to ensure that you are safe and that all your treatment goes ahead as planned but also to make sure that our health system remains safe.
To all our communities out there, all our Aboriginal and Torres Strait Islanders who are affected by cancer, please be aware that you are so important to us. These are hard times and self-isolation and looking after yourselves are paramount. It's important for you to know that the hospitals are open for phone advice and even to see you if there is an emergency or if there's any problems.
Whether you are from the city or country, you might be worried about visiting a hospital or your general practice. There are many telehealth options available thanks to increased funding by our government. Please explore this option with your GPs and your specialists.
These multidisciplinary teams, doctors, nurses, and allied health, are tremendously skilled at developing a treatment plan for our cancers in all the circumstances we face.
At this time, no cancer patient should feel alone. Our world-leading doctors and nurses are grouping together, each and every one of them, to support you.
I want to reassure you that support services will continue to be available. Like our 13 11 20 information and support line, it will continue to be here to provide you with the informational, emotional and practical support that you may need to get you through.
And we want you to know that we have your back and we are here for you now more than ever.
We are your cancer community. We want to reassure you that we are here to ensure your needs continue to be met during this pandemic. No matter what stage of the cancer journey you're on or how cancer is affecting you, we are working together to help you to navigate this difficult time. Please stay safe.
Thank you. So as you can see, you know, from the voices of the specialists and the teams that are involved in your treatment, everybody, it's still their number one priority. So, you know, just to cover off some of those support networks that are there and available for you, you've obviously got the Breast Cancer Network Australia. They have an online network and they actually have a helpline as well, which is something that I wasn't aware of until I started through my journey. But I actually was allocated a breast cancer nurse who gave me this hotline number, and essentially that's your safety net. It's a call, it's a number that you can reach at any time to speak with a nurse who can put you in contact with anybody who you need to support you through this process. There's also a number of forums and online connection points through the Breast Cancer Network Australian website. So please log on, have a look around, get familiar. If it's not for yourself, for a family member, plenty of support networks, carers, they're all welcome, as well as Pink Hope. Pink Hope is an amazing charity and also business who support a lot of people going through this. As you heard from Sarah earlier, they've got a lot of fantastic information and a lot of resources there that are available for, again, both patients and also carers and their family and friends. There's also quite a lot of following on Instagram, Facebook, and obviously telehealth appointments, as was mentioned in the video. So, you know, you have a lot of options there to support you. I guess, next slide if we can. One of the main things is that, you know, as somebody going through this, you are the only person who knows and understands how you feel, both physically and mentally. So you need to be your best advocate. Tell your doctors and nurses if you're feeling anxious. You know, if you don't want to attend in person, let people know exactly what it is you need. You know, in this circumstance, there's a lot of things that we feel are out of our control or that we've lost power to make decisions for our well-being and our future. But some of the things that we can take back is that ownership around alleviating those feelings of not being supported, and making sure that you reach out to those specialist teams and all of those networking options that are available to you to get you both the most up-to-date information, but also to just alleviate any fears and assist you in your processes. The other things as well is, you know, if you need to attend appointments, but you can't have somebody because of the COVID-19 there with you, doesn't mean that they can't drive you and wait in the car park and be there ready to support you on the way out. You know, that was something that I did. You know, being diagnosed in February meant that I had to go to my very first chemotherapy appointment and received treatment, which was really, really scary on my own. But I had my partner who drove me, who walked me to the door, and I knew he was going to be there outside that door as soon as I finished. And, you know, in today's society as well, we've got our technological, you know, devices, you know, FaceTime if you need to, WhatsApp, you know, all of these fun things that we've got. Utilize those to have those people around you. And if you need to take a safety blanket, whatever it is, it's going to make you feel safe and secure. But essentially, yeah, just be your biggest advocate and let those around you know exactly what it is you need and how you're feeling about all the steps in your journey. That's essentially it from me. Thanks, everybody.
Thank you very much, Bianca, for a very uplifting and reassuring talk. So, and I'm sure we'll talk more with you in a little while. So thank you for that. Our next speaker is Dr. Jody Fleming, who's going to talk about the range of factors impacting upon survivorship. She's a clinical and health psychologist, retreat facilitator, keynote speaker, author, and BRCA1 positive breast cancer survivor. She supports patients through a range of situations in a private practice, the psychology of it, as well as through her work with Emmanuel College of Womerville. Jody's career commenced as a clinical and health psychologist in psycho-oncology, following work in a range of cancer services, including Canteen, Mater Misericordiae Hospital, and the John Hunter's Children's Cancer Hospital in Newcastle, New South Wales. She's regularly sought out as a guest speaker to share her unique perspective as both patient and doctor, as well as appearances associated with her first book, A Hole in My Genes. A Hole in My Genes is a breast cancer memoir about Jody's professional and later personal, candid, raw experiences of being diagnosed with 2 primary breast cancers at the age of 37 and later discovering that she is BRCA1 positive. Dr. Fleming, over to you.
Oh, thank you very much, Patrick. I'm highly embarrassed because my story is not unique, even amongst the speakers that we've had today. So thanks so much for having me here to talk today about survivorship issues. This is a very brief introduction to what is a very vast topic, and I'll obviously be speaking from both a professional and personal perspective. Next slide, please, Nicola. I created this word cloud just to kind of illustrate visually how many, you know, very common experiences we have in this period that is known as survivorship. And the term survivorship in itself can be quite a confusing term. It's one that I certainly didn't understand myself, I don't think, early in my cancer trajectory. Some people might use the word survivor to describe the period immediately after active treatment finishes, which is certainly a very significant stage of the cancer roadshow. Others might wait till that magic 5-year mark before they start using that word survivor. But in actual fact, survivorship begins the moment you're diagnosed and it lasts until the end of your life. So for those of you just realizing now that you're a cancer survivor, welcome to the club. Survivorship is often one of the most difficult stages of having cancer, and particularly so when active treatment ends. That's a period of time where people describe feeling as though their safety net of regular appointments, regular checkups and scans with their doctors and their teams, regular contact with their teams is ripped out from under them, and it can be an incredibly confronting period of time. Of course, it's not true. The supports remain in place, but I suppose those more regular reassurances aren't there, and you can often feel like you're free falling without a parachute. I remember when I was set free, once chemotherapy finished, and my oncologist said, "I'll see you in 3 months. You're not having any more scans. You're not having any more blood tests unless you have a reason to." And I remember just asking, but what if it comes back? How will I know? And that hypervigilance around every, sore finger or, headache and wondering, is this my cancer coming back? It's also a time when you start to look a little bit better and even feel a little bit better, and most of your friends and family go back to their normal everyday lives, and they kind of expect that you'll go back to yours as well, except you can't, because it's not the same anymore. People might even stop asking you how you are, and you might be glad for that for a little while, because you don't always want to be seen as their friend with cancer. But also you haven't gone back to normal, at least it doesn't feel like it. And you start to wonder, should I have? And what's wrong with me? And why don't I feel like my old self anymore? I hope to talk a lot about the new normal and fear of recurrence in the Q&A session. The truth is, cancer doesn't stop when the treatment ends, and it can be the gift that keeps on giving, in good ways, bad ways, and every other way. Can I have the next slide, please? This slide highlights some of the more common survivorship experiences, many of which I experienced myself, and many I talk about with my clients and here in the cancer groups that I'm involved with. I've already mentioned the new normal and fear of recurrence, and for those of you listening, I know you'll know exactly what I'm talking about. It's important to know that at least half of cancer patients, the last research I read, will experience long-term side effects from their treatment, including things like fatigue, early menopause, and all of the joy that comes along with that, chemo brain, sexual dysfunction, body image issues. The list really does go on. It's really important to know that just because your cancer treatment has finished doesn't mean you can't seek help from your treatment team, usually now including at least allied health, alternative health professionals, to deal with some of those ongoing side effects. Being a cancer survivor isn't all that bad, and in fact, myself and many of my clients have spoken about how in many ways it's the best thing that ever happened. And I don't feel so good saying that, knowing that many people's stories don't quite go the same way mine has. It can bring about so much personal growth. We're often left in awe of what our bodies, what our minds, what our spirits were able to accomplish, things that we never dreamt we would be able to do. It can give the gift of perspective. It can allow us to reevaluate and reconnect with our values and what's important in our lives, which can lead to more meaningful and purposeful lives than before. I'd just like to share one little model of well-being with you. If we can have the next slide, please. This is the happiness pie. It's not a perfect model, but it really highlights the point I'd like to make. It's a model that seeks to explain the differences between our own individual experiences with the satisfaction of our own lives, our well-being, our happiness. Often when you're living with cancer, going through cancer treatment and everything that comes before and after that, it can feel as though cancer has taken up 100% of your life. But this model tells us that that's not true, that life events, the things we don't plan for, the things we don't ask for, only account for 10% of that. 50% of it's made up of a genetic set point and things of a nature perspective, leaving 40% of it within our conscious control. So 40% of our life satisfaction comes down to how we choose to intentionally think, our mindset, and the actions and choices we make, the behaviors that we do in our life. So I want you to keep that in mind. You can go to the last slide, please. There are so many wonderful resources out there for health professionals, for patients, for families, for carers. There's some wonderful, easy online training that you can do to increase your knowledge on the topic of survivorship. There are books to read and download for free. There are videos to watch. And these are just some of the favourite ones that I found and wanted to share with you. This is clearly a topic that we could speak about for hours. I just wanted to touch on some of the key points, and I hope to answer some of your questions in the Q&A. So thank you so much for having me.
Thank you, Dr. Fleming. That was, again, a very uplifting and encouraging talk for survivors. And so thank you for those insights.